Measles is not an insignificant disease. Even a mild case of measles results in fever and rash and discomfort and light sensitivity and all kinds of mild symptoms that require a child to stay home and can be really uncomfortable, and the kid's going to be crying and unhappy, for a couple of weeks. But 1 in 20 of those cases is going to require hospitalization, oftentimes with something like a secondary respiratory infection or a pneumonia that is severe enough to require hospitalization. So in maybe 1 in 100 of those cases, you'll end up with a really high fever that could result in seizures or other complications. In a smaller number of cases than that, it's possible that this could result in death, again, oftentimes from a secondary infection, either in the lungs or the gastrointestinal tract. My name is Matt Ferrari. I'm a professor of biology here at Penn State and the director of our Center for Infectious Disease Dynamics. Just this last week, the Pan American Health Organization, which is the Western Hemisphere's independent version of the World Health Organization and was in fact the predecessor of the World Health Organization and the basis on which the World Health Organization was formed, announced and told Canada they've lost their measles elimination status, which means that there has been continual transmission of measles virus in Canada for the last 12 months. The entire Western Hemisphere, Canada and the United States, have had measles eliminated for decades at this point. And now that has changed. We have continual transmission of measles for over 12 months in Canada. It will take at least 12 months for them to regain elimination status. So they have to first get cases to 0 and establish and stay at 0 for another 12 months. So this is a meaningful indicator of ground being lost in our fight against measles virus. I think there's a meaningful chance that the United States will follow suit here. The outbreak in the United States began, give or take, the beginning of January in 2025, and we've had continual transmission ever since then. There are new outbreaks in the southeast of the United States and continued transmission in the southwestern United States. And so if that continues through to January of 2026, then the United States is going to get that same miserable call saying that we've lost our elimination status as well. And again, it's an important symbolic loss indicating a backsliding of our control against this virus. There really is only one thing to do to fight measles, and that is to get vaccinated and to get your children vaccinated. So if you as an adult haven't been vaccinated, you should really consider doing so. Generally speaking, most people in the United States born since the mid-1970s have been vaccinated with at least 1 dose. You're more than welcome to seek out whether or not you were, look back through your history, and if you weren't vaccinated, then I would encourage you to go and seek out vaccination. All children should be vaccinated if they are able to. There are some kids, because of autoimmune responses and other things, that cannot be vaccinated. Those are the kids we really need to worry about, and those kids are the ones that we're additionally protecting by vaccinating everybody else. Everybody that gets vaccinated protects themselves from disease, and then also helps those kids that for other medical reasons can't receive the vaccine. And without a doubt, it's as simple as that. Get vaccinated, and we'll get back in control of this disease.